Have you experienced any of these symptoms in the past? Burning, stinging, excessive tearing, itchy, red, irritated eyes, blurred vision? If you've had any of these symptoms, you are probably suffering from some form of dry eye. Today we're going to talk about dry eye and some of the different ways we have to treat it. Hi everybody, I'm Dr. Allison Young from the Eye Surgeon channel, and today we're going to be talking about one of the most common things we see in the office every day, and that is dry eyes. Dry eyes can be caused by a host of different problems. Probably one of the most common is that just as we age, our lacrimal glands, which are what produce our tears every day, start to produce fewer and fewer tears. But in addition, we're starting to see dry eye in younger patients as well, as we are all glued to screens all the time. The kind of constant use of screens and staring at things all day will decrease our blink rate, which will also cause dryness. Medications can also be a big source of dry eye. A lot of the blood pressure medications that folks are on that have a diuretic component that tends to dehydrate us if we're not careful, that can dry you out. And honestly, if you look at the side effects of most medications, most of them will say that dry eyes are a consequence of them. So there are a host of different reasons the eyes can be dry. Let's talk about some ways that we can get them feeling better. Okay, so let's talk a little bit about the anatomy of dry eye. So here is our eye and surrounding tissues. Right underneath our eyebrows where our lacrimal gland lives, and this is what produces all of the tears. Those tears then flow over the surface of the eye and eventually drain through this nasolacrimal duct, which empties into our nose and the back of our mouth. So the two most common reasons that we have dry eye are either one, we're not producing enough tears, our lacrimal gland is starting to slow down in tear production, which happens as we age or with certain autoimmune diseases or medications, or two, the tears that we are making are not staying on the surface of the eye, they're evaporating too quickly. This is called evaporative dry eye. Evaporative dry eye is actually much more common than tear deficiency dry eye. And the reason for that is if you've watched any of my prior videos about blepharitis or styes, we've talked a lot about these little oil glands. These glands are called meibomian glands, and their job is to secrete oil onto the surface of the cornea to keep our tears in place. And when those oil glands get plugged up, every tear that we make is just evaporating off into the atmosphere. So let's talk a little bit more about the symptoms. One of the things that's really interesting about the cornea is that it is the most densely populated area of neurons of any tissue in our body. So it's extremely sensitive. And that's why even if the eyes are only mildly dry, they can be really uncomfortable because those nerves are exposed. Those corneal neurons are supposed to be covered always by a nice layer of tear film. And when that tear film is missing, those nerves are exposed and they can get really angry. So the most common symptoms that people are going to experience are burning and stinging. A really common one is what we call foreign body sensation, the sensation that something is always in your eye, but every time you look, there's nothing there. Another super common symptom that's kind of confusing because it seems very counterintuitive is what we call reflex tearing. So a lot of times patients will come in and say, my eyes are just tearing all the time. You know, I go outside and it's windy, or I'm inside and the air conditioner's on, or the AC from your car, and your eyes just start tearing like crazy. And then when I tell them that's dry eye, they think I'm crazy because they're saying, no, it's tearing all the time. That is a reflex tearing that happens. When the cornea is very dry, it will send a signal to that lacrimal gland I was talking about before that says, hey, I'm really dry, I need you to help me out. And the lacrimal gland will just pour, kind of open the floodgates and pour all of this water, these tears, onto the surface of the cornea. So we actually need to break that cycle of constantly being dry and telling the lacrimal gland to make more tears. So we'll talk about that in a little bit. Some other symptoms can be blurred vision. That's a really common symptom. Again, going back to that tear film being necessary for not only the comfort and health of the eye, but also for our visual acuity and just the crispness and clarity of our vision. The cornea being covered by that tear film is like the cornea wearing a contact lens. And so if that contact lens is missing, our vision is going to be blurred. So if you've ever noticed that you start out reading a book or working on your computer and everything looks fine, and then all of a sudden as time goes on, things start to get a little blurry and you find yourself having to blink a few times to clear things up, That's what's happening. You're experiencing this evaporation of the tears, and then all of a sudden everything gets blurry. Okay, so let's talk about how we can treat dry eye. There are a whole host of different ways that dry eye can be treated. But a lot of times if you can do some really simple steps that you just incorporate into your daily routine, you can avoid having to use prescription medications or having to have more involved procedures in the office. So again, kind of going back to the two reasons we're dry, either one, we're producing too few tears, or two, the tears that we are making are not staying on the surface of the eye, they're evaporating too quickly. So to deal with the first part, not making enough tears, you can go to your local grocery store, your Walgreens, your CVS, any kind of drugstore is going to have something called artificial tears. Artificial tears are exactly what they sound like. They are drops that have the same kind of formulation of our natural tears. There are a million different brands that you'll find over the counter. This is TheraTears, this is Sustain, this one's called Soothe, this one is called Retain. Lots and lots of different brands, and the brand really doesn't matter, but what you want to make sure you notice is that the box says artificial tear, lubricating drop, moisture drop. You want to avoid anything that says get the red out, like a lot of these Visine type products. If it says get the red out, that means it's a vasoconstrictor. It's constricting your blood vessels, which is something we don't want to do on a regular basis. If you continuously use those drops, you get dependent on them, and then if you stop using them, you'll get this thing called rebound vasodilation. So your eyes are looking great, they're all white and wonderful while you're using these drops, and then you stop using them and all of a sudden they're really red and angry. So you don't want to get dependent on those vasoconstrictors. So steer clear of anything that says get the red out. Tear drops can be used anywhere from 1 to 4 times a day. I usually recommend folks start at 3 or 4 times a day and then just kind of play around with that frequency until they find a regimen that is keeping their symptoms at bay. In general, if a drop comes in a bottle, so if it looks like this, and comes in a bottle, then it by definition has preservatives. So that's fine. That's what allows this to stay on the shelf, for a year or more. But because it has preservatives, you don't want to be using that in the eye more than 4 times a day. So if you find that your symptoms are so severe that you need to use the drops, every hour, every 2 hours, you should really look for the preservative-free drops. They're going to be really easy to find because they'll come in these little vials. If it comes in one of these vials, it's preservative-free. And those can be used safely every 15 minutes if you want. So when you're looking for anything more than 4 times a day, make sure you do preservative-free. So we've dealt with how we can get more tears on the surface of the cornea. How can we get them to stay there? Again, going back to those meibomian glands that are secreting that oil onto the surface of the cornea to keep our tears in place. If those glands get plugged up, then they're not going to secrete that oil, and every teardrop you put in is just going to evaporate out into the atmosphere. So what you're going to want to do is use a warm compress. This is just one of a million different kinds that you can get over the counter by OcuSoft, but these are prefabbed warm compresses that you can throw in the microwave for 5 or 10 seconds. They get really nice and warm. Then you're just going to lay down on your couch or your bed and put that warm compress over the surface of the closed eyes. Leave it there for about 5 or 10 minutes. That's going to just act like melting butter to open up all of these oil glands so that you have that nice kind of retaining wall that we're meant to have physiologically to prevent the tears from evaporating off the surface of the eye. Okay, so you've got your artificial tears, you've got your warm compresses to keep those oil glands flowing. One thing that you can do from a nutritional standpoint is consider incorporating additional omega-3 fatty acids into your diet. Omega-3 fatty acids are found in foods like fish and some certain vegetables, flaxseed, walnuts. You can also find these just in pill form, in capsule form, over the counter at your local drugstore, either flaxseed oil or fish oil. Studies are a little kind of all over the place with how beneficial these are, but most would agree that there is some improvement through anti-inflammatory mechanisms in the flow of those oil glands. So that's an easy thing to kind of incorporate into your diet. Sometimes omega-3 fatty acids or fish oil can cause increased bleeding or bruising, so you want to be careful with that and kind of talk with your doctor about possible interactions with other drugs if you plan on incorporating this into your diet. But if it's safe, that's a great, easy way to help keep those tears on the surface of the eye. Some other things that are really important are just kind of considering your environment. So a lot of times, one of the reasons we're really dry is that we just have air blowing on us all the time. We have the vent from our car, we have, an overhead vent in our house or a ceiling fan when we're sleeping at nighttime. And so as much as you can, trying to point those vents away from you so they're not directly in your face helps a ton. A common thing is just the excessive screen time that we all deal with now all the time. And so there's a really simple kind of old-fashioned rule that I love to share with patients called the 20-20-20 rule. And that is when you're sitting in front of the computer or you're reading or you're doing anything where you're concentrating for a very long time, every 20 minutes you take a 20-second break and you look 20 feet away. And during that time, you just kind of allow your eyes to blink, to relax. It also relaxes your accommodation, which is what we have to use when we're looking at something up close like the computer. So we can just kind of relax our eyes. It helps with eye strain, and it also helps substantially with dry eye. So that's a really easy thing to do. If you work on a computer a lot, another thing that's nice is to make sure that your computer screen is slightly lower than your eye line, your vision line, so that you're not having to look up while you're looking at your computer, you're looking slightly down, and that ever so slight lowering of your upper eyelids will help keep the eyes more lubricated as well. So those are just some basic little things that you can change in your day-to-day lifestyle and environment that can make a substantial difference in your dry eye symptoms. Okay, so there's kind of a basic primer on some of the simple things we can do from home to help treat dry eye. There are a lot of dry eye cases that are pretty resistant to just your regular over-the-counter treatments, and so those are going to require some prescription medication or additional procedures that we do here in the office. So we can talk a little bit more about that in the next video, but for now, hopefully that was helpful for you guys. Again, if you enjoyed this video, please remember to like and subscribe to this channel so you can stay up to date with new videos that are to come. Have a great day.